Low blood pressure, fast heart rate, weak patient, think shock. But here's the big question. Is it infection, an empty tank, or a failing pump? Because septic, hypovolemic, and cardiogenic shock can all look scary fast. But the cause gives you the clue. Shock means the body is not getting enough oxygen-rich blood to the tissues. The organs are basically saying, we need blood flow now. If shock is not recognized quickly, the brain, heart, kidneys, lungs, and other organs can start to fail. Here's the simple breakdown. Septic shock is usually an infection problem. Hypovolemic shock is a volume problem. Cardiogenic shock is a pump problem, same dangerous result, poor perfusion, but three very different causes. Septic shock happens when infection triggers a massive inflammatory response. The blood vessels relax, widen, and become leaky. So even though blood may still be inside the body, the pressure drops because the system becomes too loose and leaky. With septic shock, look for infection clues: fever or low temperature, fast heart rate, and fast breathing. Look for a possible source like pneumonia, urinary infection, wound infection, line infection, or abdominal infection. Hypovolemic shock happens when the tank is too empty, the body has lost blood or fluid. There is not enough volume for the heart to pump forward. Think bleeding, dehydration, vomiting, or major fluid loss. With hypovolemic shock, look for bleeding, dehydration, burns, dry mouth, and poor skin turgor. Watch for cool, clammy skin, weak pulses, low blood pressure, and low urine output. Cardiogenic shock happens when the heart cannot pump enough blood forward. The tank may have fluid, but the pump is too weak. A major cause is a heart attack, but it can also happen with severe heart failure or dangerous rhythm problems. With cardiogenic shock, look for chest pain, shortness of breath, low oxygen, and cool, clammy skin. Watch for EKG changes and signs of fluid backing up into the lungs, like crackles or pulmonary edema. Here's a quick skin clue. Early septic shock may look warm and flushed because the vessels are dilated. Hypovolemic and cardiogenic shock often look cool and clammy, but cardiogenic adds chest pain and lung congestion. Important safety point: not all shock is fixed the same way. Hypovolemic shock often needs volume. Septic shock needs fluids and antibiotics. But be careful with cardiogenic shock. Too much fluid can worsen the lungs. At the bedside, assess mental status, blood pressure, heart rate, and oxygen saturation. Check skin temperature, lung sounds, urine output, labs, and what likely caused the shock. Nursing priorities are fast recognition, calling for help, and starting oxygen if needed. Secure IV access, start cardiac monitoring, and maintain strict intake and output records. Here's the memory trick. Septic shock is a leaky infected system. Hypovolemic is an empty tank. And cardiogenic shock is a broken pump. Remember those three pictures to think faster at the bedside. Quick recap. Septic starts with infection. Hypovolemic starts with blood or fluid loss. Cardiogenic starts when the heart fails to pump. Different causes, but the same dangerous result. Don't just treat the blood pressure. Find the cause fast. Infection is septic, empty is hypovolemic, and broken is cardiogenic. Join us at the Nurse Scrub Club, where we make complex nursing topics simple, visual, and memorable.